Let's talk about the ankle. So the interesting thing is most patients that come to your office are going to present with a sprained ankle if we're talking about that particular joint. And a sprained ankle is basically flexion and inversion of the ankle joint. And therefore they get stuck in this position because, of course, the ligaments were modeled to stress. So in terms of some detail of this, you can see what this looks like. You have the talocrural joint, which is between the tibia and the talus, and the subtalar joint between the talus and the calcaneus. And when there's a sprained ankle, all these lateral ligaments get overstretched and some of the anterior soft tissue so that the foot is, as I showed you, plantar flexed and inverted. And of course, when those ligaments stretch, the patient will need some mobilization to bring it back into a resting neutral position. So what we need to do is we're going to need to dorsiflex and evert the ankle. And using the body's own inherent energy, we're going to have you put your thenar or your pisiform on the talus, this top bone here, and you're going to push down as the patient lifts their foot up. Lift up your toes and foot. Good. Now that's going to dorsiflex the ankle joint while also mobilizing the talus. The second thing you can do is to grab the calcaneus, which is the lower bone, of course, just below the ankle, and say, turn your foot out a little bit. That's good. And that's how we get eversion. And you may actually need to do this along a few different points where it gets very stuck, because it can get very stuck anywhere along this lateral ankle line. And that's probably the most important thing you can learn about the ankle.